Welcome to the loft. In today's video we're going to cover the hips. So we're going to retrain the rotators of your leg, the muscles that turn the thigh bone out and in. We're also going to retrain the gluteus medius, the muscles on the side of the pelvis that helps us stabilize the sides of our pelvis. So you're going to need a head and neck support, a comfortable place, a mat. You can do it in your bed if you'd like, as long as it's not too soft. Maybe another towel to put under your waistband area, and something to hold behind your knee, so to help us engage the hamstrings and stabilize the knee joint. So in this instance, I'm just going to hold this little air peanut. So we're going to start lying down onto your side. I'm going to use the towel, place it under my waistband and ribs area. And I have enough head and neck support to be comfortable. Your knees are bent. Sit down, sit down, sit down, and stay. He always wants to come on the mat with me when I train. So you take whatever it is you're going to be using behind your knee and you're going to hold it. Knees are bent. So here we really have to pay attention to the pubic bone. We want it to be really weighted towards the bottom hip. And we're going to start lifting the knee and lowering it down. Just this for now. And you're going to do 10 of those. Now what you need to watch for is that you're not rolling your pelvis, even a little bit. See if you can keep the pubic bone weighted. Feet are together. So I'm not really counting, but let's say this is 10. And now we're going to do the opposite. I'm going to go up, foot and lower leg are lifting. So we're practicing internal rotation. What I'm not doing is rolling all my pelvis. Right? Just the foot and the lower leg so the thigh bone can turn inside the pelvis. The other one is not wrong, but it has a different purpose. We are looking to lengthen here the muscles of the rotators and to release some tension in the inner thighs. Okay, we go for 10. So you're counting, and then we're going to lift. We lift the leg, holding whatever you have behind the knee. And once again, making sure that we're not lifting the pelvis with it. We keep the pubic bone really weighted towards the bottom hip. I'm going to go for 10 again. By now, some of you may feel a little bit of burn in the back of the hip, as that's okay. And now we're going to hold up. I'm just going to stay up and I'm going to practice turning in, turning out, turning in, turning out. When you're turning in, you're going to feel it's easier to feel the weight of the pubic bone dropping. When you're turning out, it's challenging to keep that pubic bone down. But you're still aiming for that. So we go for 10. That means 1. That's 1. That's 2. Now, many of you by this time, you should feel like it's burning in here. So we're going to rest. And we're going to start again. Whenever you feel rested, you can tap, tap, tap that area. You can massage it. Stretch the leg if you need to. And when you feel ready, you lift again. We're going to go for 5. Keeping the pubic bone very weighted. And you keep up. So now we're going to open the front of the hip. I'm going to keep the pelvis where it is, and I'm going to lengthen the muscles in the front of the hip. It is normal to feel the thigh bone turning in a little bit, and that's fine. So it's a nice little opening and stretch. I don't want my pelvis or my spine to roll forward. I'm going to stay on my side and just open the hip instead of finding the openness in the lower back. Now we keep the leg open and we turn. And again, you're trying to do 10 of those. Turning in, turning out is 1. I'll do 10 with you, but I'm a very bad counter. Now, what we're going to do, we're going to rest down. You take everything out, towel. You need to come down a little bit with your head and neck support, and you're going to lay down onto your back. And just take a moment to notice how it feels. You should feel the difference between the two sides of your pelvis, the two hips. Some people even feel the difference all the way through one side of the body. And now you need to redo the other side. All right, you on your own. Leave me any comments, any questions below, and I'll answer to the best of my ability. Thank you.